Good afternoon, board members. Thank you so much for taking time out of your schedules to meet with me today. As the new Executive Director of Healthy Communities Brookfield, I've done a lot of research the past few months. I've learned the ins and outs of this organization, have an understanding of where we are now, and have a plan for the future. Seeing that several of you are also new to the board, let's go over a few things and then we can talk together about where we see Healthy Communities Brookfield heading. Again, thanks for joining me, and let's get started. Let's first go over the organization's history. Healthy Communities Brookfield was formed in 1998 as a freestanding not-for-profit agency. Elaine Caulfield was a former executive director, and she was wonderful for the position. She was also a wonderful nurse, but she will also tell you that her skills as a manager and leader were limited. Ms. Caulfield hired former VNA co-workers to serve as directors with the organization, and there was no long-term financial plan and a lack of focused vision and mission, unfortunately. Healthy Communities Brookfield was previously a department of the Visiting Nurse Agency, or the VNA, and was called Brookfield Health. Then its purpose was to manage 2 state contracts for one being the intervention and prevention of cardiovascular disease in the populations, and 2, a health promotion initiatives throughout the schools in the county. In 1997, a donor gave $2 million to expand health promotion and wellness in the county. The only stipulation was that a new organization be created with its own board of directors, hence the establishment in 1998. Over the course of an 8-year period, unfortunately, the $2 million ran out quite quickly. Thankfully, in 2008, our Chief Financial Officer joined us, and the organization began to get back on track towards financial stability. Let's move on to the programs and services of our organization. I have to tell you, when I first read about all the programs and services that we offered, I was floored, absolutely shocked that one organization, a small one at that, could handle so many programs across our county. Let's discuss a few of them. Women's health and primary care medical services are one of them, and there is a list of others. Prenatal and newborn care, mobile health medical services, employee health and wellness services to area employers, case management services for the elderly recently discharged from the hospital, violence prevention programs, smoking cessation classes, diabetes education classes, teen after-school programs, school health, wellness and fitness programs, well water testing and water problem mitigation assistance, vaccine and immunization services. My goodness. That is a lot. Today's programs are all contingent on grant funding and the county budget. Unfortunately, several classes will end in 3 months, and I would love to see what we can do to prevent that. Our Chief Financial Officer's main concern is that once the funding ends for these programs or other programs, the administrative costs will need to be reduced to respond to these changes. Let me take a moment to get your brains moving. I'd like for all of you to be thinking about these 3 things, now and in the future. What programs and services do you think matter most to our community? Have you heard someone talk more highly about a certain program as opposed to another? Have you heard about one having more attendance than another? Which programs do you think we may need to cut due to low attendance? And what kind of programs do you think we may like to add in? Could we add in classes for men specifically? Could we add in classes for teens? Could we even add in classes similar to the YMCA with things that are more than just after-school programs? Could we add in sports? Could we add in something more educational? I would like for you just to be thinking about this, just to get your brains going. I'd like to get your opinions too soon. Let's talk about our mission, vision, and values. Our vision statement states that the promotion of healthy practice leads to improved health behaviors and healthier communities. Our mission is that we strive to improve the community's health by strengthening the quality and performance of health promotion and wellness practices. Our values are honesty, high-quality services, connectedness, staff, and being a public health leader. Now let me ask you, do you feel that Healthy Communities Brookfield is reaching all of these? Are we fulfilling our mission and vision and values in the community? Let's be thinking about that also. From what I have observed, I believe that we are reaching all of these. We are reaching the community and impacting lives. When you think of environmental factors, what comes to mind? Do you think about the sun and the weather and the seasons changing? Maybe so, but I want to look at environmental factors as a whole. I want to look at our community expectations, our economic forces, the political environment here, and our technology. The community sees us as a quote-unquote doing good organization, but there is still a continued lack of understanding as to what we do and who we are. Many think we are still associated with the VNA, and there are some that even think that we're a branch of the health department. There is much confusion that surrounds us. Our economic forces, we have many friends in the community and across the state that are supporting us faithfully with their words, thoughts, prayers, and their finances. Our Chief Financial Officer has developed a plan with our grant writing team concerning the amount that should be requested and the amount that should be received every year. Those numbers we will discuss at a later meeting. Our political environment is a hot topic. In every board position that I've ever held, there are politics involved. One person wants their name to be associated with the organization because of this reason or that. One may want their name on a plaque or somewhere they deem as significant. But most truly want to make a difference. Can we all agree right now that politics should be left to the politicians? This room and this organization stands for something huge, the health and wellness of our community. That is enough to concern ourselves with. I've learned over the past few months that some of our local farmers are not too fond of us. Their reasoning is that they are frustrated by the extensive well water testing program, and that program is encouraging them to invest in expensive systems. Some of our local farmers, here and anywhere across the country, the state, they may not be able to afford these type systems. So let's work on a plan together with us, even with local friends and family members. Let's work together to try to come up with a solution for our farmers. Let's have some fun with this. Let's talk about cultural assessment and our employee engagement at work. Back in April, we developed an employee engagement and organization culture survey for all employees. The survey was disseminated in May, and since then we have been able to compile the results and prepare them for you to review. Thank you for your patience on that and for encouraging us to follow through with the survey during this transitional period. So to begin, there were 97 surveys distributed and 68 were completed. We were extremely happy with that. The scale is from 1 to 5 and our average results were 3.77. with 1 being strongly disagree and then 5 being strongly agree. The first section was concerning engagement and cultural factors. Many of our employees believe that the organization has a history of efficient and effective public health service delivery, that their supervisor discusses their quality of time at work, and that they are held accountable. Those were rated higher than 4, which is wonderful to know. There are a few areas in which we are lacking, and those are recognition and rewards based upon program outcomes that we received a 1.8 in. Doing things right the first time is valued, that we received a 2.3, and resources are dedicated to educational efforts regarding quality improvement, that we were rated a 2.1. The second section of the survey is on leadership and management. We were rated pretty highly in most of these questions. The employees believe that there's an opportunity for advancement. There are the right number of managers. They are treated fairly by their managers. And they are proud to work for the organization. We love hearing things like that. The employees also felt strongly that management asked for their input and that they may disagree without fear of retaliation. We always want this to be a safe zone for all of our employees and managers. In another field, it seems that our mission, vision, and values are unclear to nearly all of our employees. They're also concerned about long-term welfare of the employees, and that the board of directors is unclear in their direction. Little do they know that we have a plan for all of these things. The third and final section of the survey is communication. That was our highest rated part of the survey, with only 2 questions below the 3.0 threshold. Employees, for the most part, say that senior leaders are not visible and the organizational plans are not communicated to everyone. The majority of HCB believes, there's good communication among programs and supervisors are always available to talk. We love having that open door policy. After I went through all of these results, all the findings, I do have a few suggestions and I welcome your opinions and your input. I believe the number one thing that we need to do right now is to have our vision, mission, and values written down and available to all of our employees. I'm sure, matter of fact, I know that they're all receiving it upon being hired, but let's be honest, a lot of them are not reading it or keeping it or holding on to it, and it's not something that they see or think about every day. Another option would be to have a staff retreat day. How much fun does that sound? We could have it at a nearby school, a park, or a YMCA. It would be paid for by us. The staff would receive the paid day to have fun, meet new staff, hear from you guys, from the board of directors, and learn about the direction in which HCB is heading. A lot of them are unsure about their future with HCB and feel left in the dark, so we have to change that. If we're planning to make drastic changes, we have to let our employees know. All of our employees deserve to know and feel that they are appreciated. Who doesn't want to feel appreciated? Whether they have been here 6 months or 10 years, we should continually thank them for their time with us. During the harder times, some spend a lot of late nights and weekends trying to piece the puzzle together. We need to reward them for those services. Finances, yikes. This 3 little syllable word in a nonprofit organization. As I mentioned before, we are at risk of losing a few of our programs and services. What I failed to mention earlier, because I wanted to surprise everyone, is that just yesterday we received notice from the Duke Energy Grant Foundation that they are granting us with $450,000 towards our programs here at HCB. Can we have a quick little hurrah for that? That's awesome news. That's great. Here on the screen, one thing I want you to look at to notice is our expenses. So we're going to switch gears just a little bit. Our expenses, as you can see, we are spending the majority of our money on our programs, which is in the direction that we want to. The next highest is our staff, and then we have a tad bit for marketing, and then a few other things like overhead expenses and things like that. So the majority of our money is going towards programs and services, and like I said, that's where we want things to head towards. But we need to look at the breakdown of the others and make sure this is where we're headed, and that we're headed in a good direction financially. I've sat down quite often with our CFO and looked over these financial statements for the past several years, and we are headed in a good direction now that we have this grant coming our way. Before, things were a little rocky, but now we are headed in a better direction, and our plan is to keep heading in that direction.